All right. Good evening, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. Tonight, we're joined by Dru Halverson, and she'll dive into first-line strategies to increase fluoride acceptance among adult patients. If there are any questions, please drop them into the Q&A section throughout the webinar, and we'll answer them at the end. And Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. Dru, the floor is yours.
Thank you so much, Adam. I so appreciate this time with all of you tonight. And I am so excited to share information with you about fluoride in adults and for adults. So if you would, please take the introduction poll. And what is your role in the practice? Just simply answer that. Adam will gather that information for us as we go. How are we doing, Adam? Are we getting information? Good.
Yeah, we've got 85% is good enough. So
oh, that's awesome.
I'll share those results.
Good. Okay, so the dentists, there are 35%, mostly dental hygienists, a few dental assistants, even fewer business team members, and some others. So I appreciate everybody being on this evening. So through my years in dentistry and in health education, it has been really interesting for me to see the devalue of fluoride treatments with adults and seeing the difference in an in-office fluoride treatment with adults and for home use, and seeing the difference in the health of the patients when we do those programs is really impressive. So as a dental hygienist, as a dental consultant for Jameson Management, and I have a degree in community health education, so all the way through my career, we have been talking about fluoride and the use of and the benefits of fluoride. So fluoride in adults can increase the patient's dental health. It can increase your patient retention because the patients will start coming back to you on a regular basis because of the value of the fluoride treatments that you offer. And in turn, it will increase the production in your practice. So let's talk fluoride. For a healthy hygiene department, though, fluoride is a piece of that, but I want to go through all of the pieces of a strong, healthy hygiene department. So starting off, you have to have a strong perio focus. For those adults, we need to make sure that we're charting, we're diagnosing, and we're treating non-surgically as much as we can in our general practices, and then referring those to the specialist. We need to have a radiograph policy to make certain that we see what we need to see for each and every adult patient. We need to have a hygiene retention system in our practices that allows for 85% of the patients returning regularly and at the proper interval for you to have a really strong focus on oral wellness. Sealant programs are very important for the young adults and the children. Whitening, it's such a huge introduction to cosmetic care, cosmetic focus, and what the patients smile, what they want that smile to look like. And then, of course, having that adult fluoride program is so important to have if you want that healthy hygiene department. Why do we need that healthy hygiene department? 45% of adults that are over the age of 30 have some form of periodontal disease. 70%. This is shocking because this is getting close, that this is hurting my heart. A lot of my friends are this age. 70% of the adults that are 65 or over have some form of periodontal disease. So you may be asking, well, why would you talk about periodontal disease and then in a fluoride lecture? Because periodontal disease, there's going to be recession. There is bone loss. There is more root surface and smooth surfaces of the teeth exposed to what is in the mouth. And that needs fluoride protection. So when you have periodontal patients in your practice, fluoride is a must. And the top deterrent, what keeps adults from saying yes to fluoride treatment? It is the cost. They couldn't afford it. Insurance didn't cover the procedures. They didn't want to spend the money for the treatment. So it is so important to be able to have great verbal skills to maximize the treatment that we do for the patients. You need to practice working through the cost objections. I've seen practices have programs and they work very successfully. I thought to myself when I was starting this, getting ready for this webinar, I thought, what have I seen that has really worked well in the practices that we've worked with through the years, and what makes it stick? What makes it work? So you need to be able to develop a plan. You have to make that plan work in your current schedule. You can't take a lot of extra time because we don't have it. We see one patient after the other. Our schedules are full. Our schedules are busy. We have a lot of other things to do as dental hygienists and as assistants in our appointments. So that plan can't take, that program can't take a lot of extra time. So we have to find a way to make it fit into this current schedule, and we need to get success from that. Believe in what you're saying. If you don't believe in it, if you don't know the successes that can happen, then you will not want to talk about that with your patients. So I want you to start tomorrow. If you are at a place where you're not doing as much fluoride treatment on adults as you want, I want you to start doing case success studies. So the best place to start is with you, the team. So if you are not utilizing fluoride varnish on your team, try it out, get them all involved. If they're not utilizing a home prescription strength fluoride, have them try it out, have them utilize it to see if it makes a difference in themselves. Have them start with the patients that are most dire. Work your way to the patients that have less need. Start with the patients that have the most need, and we'll go through who those patients are. Make sure that your verbal skills are effective, and you practice those verbal skills over and over again with each other, the team members, and then also with your patients. Know that you're never going to get 100% acceptance on in-office fluoride for adults, and then home prescription fluoride use as well. There are patients that are going to say no, and you need to learn to pick your battles, and you need to continue to educate. Don't ever give up, but understand that you're not a failure if you miss a patient or two and they say, no, I'm really not interested. It's okay. Find other products, another way to get them and keep them healthy. Look for alternative methods if those patients are not willing or able to be on a fluoride regimen. And then don't give up. Keep working toward those successes and make certain that you pat each other on the back every day at the end of the day. Talk about who said yes, what you said to get them to say yes to treatments, and what's working. Share that with your teammates so that you can successfully move your program forward. Now in Jameson, we call these the 4 pillars. We know that patients will say no if they don't understand the need for the care. And that's any care. That's restorative care, that's preventive, that's perio, any care. If they don't understand and own that they need the treatment, that we will get a yes. If they don't, we will never get a yes. If they don't, they will always say no. They may say, oh, let me think about it. Oh, you know what? Let me talk about it next time. So if you're not building the need for the care, if you're not creating value for that care, and if you're not creating a sense of urgency for that care, then they won't trust enough to get that treatment done. So where are you? Look at your program, look at what you're doing, and I want you to think about where can we build the trust with the patient so they understand the need. Are we building the urgency? And are we putting value into the program and the products that we're sharing with the patients? So it is ultimately important to remember these 4 pillars. If you have your cell phone out, and if you can take a picture of this slide and keep this in front of you all the time, this will make a huge difference in your acceptance of treatment and care, financial responsibilities from your patients as well. The purpose and benefits of fluoride: it prevents mineral loss and replaces lost minerals. What that means is it really strengthens the enamel and the root surface of the teeth. And remember, those perio patients that have that recession and have root surface that is exposed and in danger, that keeps those root surfaces harder, stronger, and more resistant to decay. So, and just like I said, reducing the potential decay on the smooth surfaces of the teeth is one of the huge benefits of fluoride treatment. Antimicrobial effects. It has an ability to kill the bacteria. Not all fluorides do that as well as others. Stannous fluoride is great at antimicrobial kill, so or effects. It kills the bacteria that causes gingivitis. So that is a huge benefit for patients. Reduces the ability of the bacteria to make acid, so it neutralizes the pH in the mouth for the patients. And it also reduces and prevents the ability of the bacteria to cause gingivitis. I've talked about that. And another wonderful benefit of fluoride is it increases salivary action. It can get a dry mouth more wet. So who has a dry mouth? Think about that. Reduction of sensitivity to hot and cold. I cannot tell you, every day, if you're seeing 8 patients in a day, I bet you have at least 60%, 70% of those patients that are saying, you know, I have teeth that are sensitive. Or if you're using an ultrasonic scaler, piezo, they're going to say, oh my gosh, I can't do this. It's just too sensitive. So know that as you go, or if you have patients that are whitening too, you'll have them be sensitive to hot and cold. when you have them utilize fluoride in office and at home, it will make a huge difference in that sensitivity that they're having. So let's talk about the ideal patient for that fluoride treatment. Is fluoride needed for every adult? Probably not. Is it wanted by every adult? Probably not. But there are patients that would really benefit from this. So make certain that you look for the adult patients that are having dexterity problems, that have a history of decay, and especially a history of decay on the smooth surfaces of the teeth. And if they've had restorations done and those margins and the contacts are restorations and they're meeting the tooth, and we want to make sure that the margins are kept tight and healthy, having fluoride in those patients' mouth is ultimately important. Orthodontics. Think of all of the issues that come up with plaque removal around orthodontics, wired or trays. So think about the clear trays, think about the aligners. How are you having your patients utilize fluoride so that they, at the end of their case, look beautiful, wonderful, straight, white, caries free smile. Dry mouth, I've talked about that already. Anybody that's taking medication that dries the mouth or that's had cancer treatment or radiation treatment and they haven't been able to keep their mouth wet, that's going to be important product for them to use. And root exposure, talked about that. Tobacco users. I'm from Oklahoma, and in Oklahoma, everybody smokes, dips, and chews tobacco. So we are in a state where those patients, number one, need tobacco counseling, which is a must, but also in turn, have them use fluoride every day and then in the office when they're there. Cancer treatment, recession, whitening treatment, I've talked about that. A diet high in sugar and carbohydrates. Now, please, I cannot think of a patient that I've seen that doesn't have a high intake of sugar or carbohydrates. Those patients are few and far between. Most of us as adults are sipping on some kind of drink, soda, power drinks all day long. And we don't oftentimes realize how much sugar is in our diet and carbohydrates that we're eating. So it's important to talk to your patients about their diet, their nutrition, and see where they stand, especially if they have a high rate of decay on the smooth surfaces of the teeth. Gingival disease, gingivitis. If you have patients that are bleeding upon probing and during your charting, talk to the patients about that. Look at their mouth. Are they having acid reflux? And then patients, of course, with poor home care. One thing that we've discovered as we go to practices is that practices will have disclosing solution for children, and they will use disclosing solution in those appointments. But when they see an adult patient that has high plaque, poor home care, they're not disclosing those adults. And I would love for you to revisit that as well and see what you can do. If you can visibly see plaque on a patient that comes to you for their hygiene appointment, please know that that's the cleanest they've had their teeth in a long time because they're nervous about coming to see you. So they've done their best job to get all of the plaque off of their teeth. They've worked on them all week because they know they're coming to you. So if you can see visible plaque on those teeth, I want you to consider disclosing the patient and showing the patient the plaque and the age of the plaque as well. We have those products now as well. So make sure that you look at that and you talk to the patients about their poor home care, and not telling them that they're not doing a good job, but interacting with them, and use the verbal skills of, let us work together as a team. Let's do co-therapy. I want to do a great job for you here in the practice. And then I want you to do a great job at home so that we can keep you healthy together working as a team. Instead of, you need to brush better, you need to floss. So utilize those verbal skills for those patients that have that poor home care. Okay, so I want you to listen to the cues of these patients that come to you. You may be saying, well, okay, well, maybe my patient doesn't have any of those qualifications that you just went through on the ideal patients to have fluoride treatment. Well, so start listening to the patient's cues. I have this sensitive area up here. It comes and goes. It gets worse when I drink hot coffee. It gets worse when I chew on ice. It gets worse in the summer when I'm eating ice cream. Whatever it is, listen for those cues. That is not a healthy patient. My mouth is full of fillings. I've had fillings for a long time. I always have one tooth that I need to have fixed. It seems like every time I come in, something is going wrong and I need to work on that. I have had bad breath. My mouth feels dry all the time. I never feel like I have fresh breath. And it's so hard for me to floss every day. So, Adam, I'd like to pull up the poll, and I want everybody to be very honest about this. I'm going to see if the statistics are right. Now, we're dental people too, but it's okay.
And this is anonymous. Don't worry. It's anonymous.
Don't worry. We're not going to show your wanted poster up here on the presentation.
All right, lots are coming in. I'm just going to go to a few more seconds here.
I'm so glad. And if everybody is flossing, it's going to be a miracle. I ask this question all the time when I do consultations or when I'm working with a practice. I always ask because we're human.
All right, I'm going to end it there. Are you ready for the results?
Yes. 50-50. How about that? Okay. So if you're not flossing every day and removing the bacteria, and even if you are, do you remove all of the bacteria when you floss, or is the bacteria, some of it still in there? So we need to think about that. Now, this is a form that we utilized in our practice, and we have practices utilize this in their practices as well. It is, take a picture of it. You can remake it however you want to. It is a great form to have on your website, to have for patients when they come in as a new patient, or even if you have tomorrow, you have 8 patients that you've seen for 20 years and you haven't asked them these questions and you haven't offered fluoride treatments for those patients. This is a great way to have the patient tell you if they need fluoride treatments or not. So you can see that a lot of this information on this form is what we've covered so far. So make sure that you have something to help you through your introduction to fluoride. It will make a big difference in your in your time that you spend with the patient doing this. If you want, you can have the business team, if it's time for their medical history update and they're completing the forms, either online or via paper, you can have them also just fill this out as they're waiting for their appointment to begin. Okay. Then we need to be very aware of our findings during our appointments. What are we seeing? What do we need to look for? And make certain that as we go through the charting and the documentation for each patient that we're seeing, we need to talk about that. We need to show them what's going on in their mouth. Intraoral photos, digital camera photos, scans, whatever it is, I would love for you to have the visual aids, and using them, their images, is the best way to get them to trust you and understand the need and the value for what you want to do with those patients. So make certain that you're documenting bleeding upon probing, pocket depths, of course, plaque level, missing teeth, recession, all of the restorations, and how those margins look on the radiographs, and then in the mouth as well. How do the restorations feel in the mouth? Is there active decay? If there's active decay, we need to make certain that we're talking about fluoride at home and then fluoride in the office. Do they have crowding? Do they have, if you're taking scans and you see the crowding, if you take photos and you can see the crowding, and even if it's they've had ortho in the past and now they're having some crowding now, go ahead and talk about that. See how hard it is for them to clean. See how hard it is for them to get to. I love to have patients floss for me. I want patients to brush for me. I can brush and I can show them, but until I see how they can brush and floss around all the crowded teeth, around all of the restorations, if they have a lot of interproximal restorations, I want to floss those. I want to feel how hard it is to floss those. Is it smooth? Is the contact tight? To make certain that that patient is really, if they have good restorations and they're taking care of them and they know how, I want them to demonstrate to me how they take care of their teeth. What habits do they have? And then medical and dental history. So I talked to a hygienist recently, and she was talking about how it feels like, she said, it depends on how the puzzle pieces fall together. So consider each one of these findings, these needed and understood things. How do all of these pieces make up the puzzle? How do they fall together? And is it a giant puzzle? And we have to, we know that this person is an ideal candidate for fluoride, or is there one piece? Is there one piece that they need to work on? So as you look at this, consider all of these different pieces that are making the puzzle come together, so you know as a team what to recommend and how to recommend fluoride treatments to your patients. So this is a Caries risk assessment, and this is from the ADA. Now, there are many Caries risk assessments, and they all have protective factors, and they all have biological risk factors. So I've talked a lot about the biological risk factors. However, I want you to pay close attention to the top of the slide, the protective factors. What do you see that all of those have in common? It's a lot of fluoridated toothpaste, fluoridated water, fluoridated higher concentrated fluoride, fluoride varnish, sodium fluoride rinse, and then chlorhexidine, of course, is a great antimicrobial. So this just seals the deal. A Caries risk assessment is not only for children. This one is for adults. And this is in every one of these Caries risk assessments, all of them talk about the importance of fluoride. The patients need to be introduced. I don't care which one you do. I don't care if you do your own. I don't care if you don't have a set formula. However, you need to understand that the main protective factor in reducing caries is fluoride. And adults have a high risk of decay on the smooth surfaces of the teeth. And we don't want our adult patients to lose a tooth or to have multiple restorations that are wrapping around the gum line and up and down the tooth. And as we get older and our mouths get drier and we have more medication potentially, then as we get older, our dexterity gets worse and we can't take care of our teeth. So a virgin tooth with no periodontal disease is your best bet for staying healthy longer and being independent longer. Doesn't that sound great for everybody? Now, you 20-year-olds out there, you may not see that yet, but you will. We're going to talk about the 1-2 punch. I've talked about in-office fluoride and I've talked about home fluoride, and there's a reason, because the in-office fluoride it's a higher strength fluoride. It has a higher uptake. We've just cleaned everything off. The fluoride uptake with the in-office fluoride varnish is the highest. And we want to make sure that the fluoride varnish is utilized. It is amazing. It's easy, simple and easy to get on the teeth. If a pediatric dentist or hygienist can get fluoride varnish into a 2-year-old's mouth, or somebody that they can not hold still very well, we can do that for our patients as well. So we want to select the product that best suits the patient. We want to make sure that the fluoride varnish doesn't need to contain amorphous calcium phosphate. Does it need to include xylitol? That varnish will remain on the teeth for 4 to 6 hours. It provides time-released dosage, net dosage, and over a longer period of time. That's a huge benefit for the patients. You don't have to apply the product on every tooth. And it was interesting as I was getting my slides together, it's so hard to find somebody applying fluoride and really putting it in the right places. So making sure that you really push that in between the teeth, and you don't have to make mountains on the surfaces of the teeth. You can put a smooth layer on there so the patients, the adult patients especially, don't complain about, oh, it's rough, oh, it's sticky, oh, it's I don't like it. Well, you know that you can make that smooth surface with the fluoride varnish, and then you can push that fluoride where it needs to be, but you don't have to touch everything because the fluoride will move to where it needs to go. And it doesn't just automatically stick in one place. It will gradually flow and move. That's why it's so runny, but yet not too runny. It is effective. If it's applied every 6 months, you can do that sooner if you want to. If you have a periodontal patient that's coming in every 3 months, why not put it on those teeth every 3 months? You can have the patients that have gingivitis or that have a high risk of caries come in for only a fluoride treatment if you want to do that. Talk to the patients about that. If they want that and that's going to benefit them, then that is a great way to get patients back in the office, increase your hygiene retention, and have those patients know that this is making a difference for them. They can eat or drink immediately after. They have to stay away from hard, crunchy foods or hot drinks or hot food. And it's, like I said, it's really good for difficult patients. And there's good, great colors, white, clear, and you will find through Henry Schein the products that you need to fit your practice. Prescription home fluoride treatment. This one, there are so many options out there now. And I want you to think about your patient base, and I want you to get fluoride in your practices that works for your patients. My patients in Oklahoma or my patients in my practice may need different things than what your patients in your practice need in Washington or in New York. So be sure and talk as a group about what fluoride products need to be utilized in your practice. Have representatives come in and talk to you about the options and what's being utilized in practices that has been successful and is beneficial to the patients. So neutral sodium fluoride is amazing. It has a milder flavor than one that has a higher acidic base. And then you can also get those fluorides with additives, xylitol and ACP. They're available in rinses and in pastes. Why I'm talking about home fluoride is because, listen, if only 50% of us floss every day and we're dental professionals, what do you think the patients do? So I've heard statistics as low as 10% of your adult patient base will floss on a daily basis. And probably all the hygienists are going, yes, I know, I understand. That's exactly what's happening. It's awful out there. So most patients will brush at least once a day. Now, we want them to brush twice a day. We want them to brush 3 times a day. We want them to brush after every snack that they have. Reality is patients will typically brush once a day or twice a day, whether they need it or not. So I want you to know that putting a paste on a toothbrush is much easier for the patient to do. So your compliance is going to be higher. Why would I not have a patient go to Walmart or Target or a drugstore with a prescription and go pick up the fluoride? Because I, as a patient, don't want to do that. I don't want them to get another brand. I don't want them to get another product that might not have the additives that I want them to have in that fluoride that they use every night. So compliance is higher. We have found if you have the product in your office and you sell the product to the patient. Now, I know it's not easy. You have to keep it stocked. It can't expire. You have to collect tax, sales tax, all of those things, work through that as a team so that you can have your program in place, and it's simple and easy for you, and it's simple and easy for the patient. So patients will, I'm going to go back to the toothbrush, patients will put something on their toothbrush and brush their teeth. Now, the nice thing about the paste is they taste amazing, and they don't suds up as much. And so patients can remove plaque easier. And I see fluoride paste, as that prescription strength fluoride paste, as just a little gem that they can use every day. If you want them to use it twice a day, they can use it in the morning and at night. The important thing is, for the prescription strength fluoride, is the patient has to be able to spit the fluoride out. So if you have a patient that can't spit effectively, too young, too old, stroke, whatever it is, make sure that the patient can spit out and they can brush it on. It will make a huge difference for your patients. Stannous fluoride, this is more effective for periodontal gingivitis patients. The rinses are really amazing for the perio patients, because you could put them in your water pick, You could swish with it, in between morning and evening. You could take some of it to work and swish after lunch. It's an easier product to utilize on the road. And then your perio patients are going to be more apt to want something different and to do, to get the change, to get healthy faster. So it's a preventive measure, but yet it also prevents the patient from getting worse. So remember that. So the main objection to deal with, I want you to guess. It is hang on to that. So Adam, I want you to put up the poll. So currently, what is the percent of adults that receive in-office fluoride and home fluoride in your practice? Single choice. Pick one or the other.
This one's a runaway with less than 50% is the choice.
Oh, it is already? That was that fast?
Yep. Got some smarties on the line.
So if you're utilizing that with less than 50%, is there opportunity? Is there an opportunity to be better with that, to look for opportunities, and then to see the difference in those patients, and to have them and you looking at that patient every 6 months, every 3 months, in a proactive, preventive way. So take a guess. What do you think the main objection is for adult acceptance for fluoride? You're right. Does my insurance pay for it? We hear that every day, all day long, and not only just for fluoride, but everything else. So if insurance isn't going to pay 100% of it, I'm not going to do it. Wow. This is amazing. This is crazy. Now, why do you think children get more fluoride than adults? Because insurance pays for the fluoride for the children, but it doesn't pay for the adult fluoride. So it's the cost, it's the investment. And we have to do a really great job at promoting the benefits of the fluoride, choosing the right patients, then promoting the benefits of the fluoride, and then utilizing really great verbal skills. So this is how I would take care of that patient. I would have them take the quiz that I showed you earlier, and then I would choose one that seems most important. And I can tell you, typically, even in dental practices that we go to, I have the dental teams fill that quiz out. And every time I go into the practices, every team member, the average is they answer yes to 5, at least 5 or 4 of the questions. So I will say that you will have 5, 6, 7 from patients, and you need to, as a provider, review the answers that they've given you. And then I want you to pick a couple or one that is the most pertinent, the one that is the most important to the patient and to you, to prevent, to get better, to offset the issues that they're going to have if they don't have that extra fluoride treatment. So I would say I can provide a fast and effective treatment that would relieve your sensitivity, Mrs. Jones. Would that be something that interests you? Mrs. Jones, on your quiz, on your questionnaire that you completed, you gave me 5 yes answers. And the one that is most concerning for me, after looking at your radiographs, after looking at your photos, after doing your perio charting, after looking at your dental history and your medical history, the one that is most important, I believe, for us to focus on is blah, blah, blah. Okay. So, and I would say decay, or decay on the smooth surfaces of the teeth, or keeping those margins on all of the crown and bridge work that you have in your mouth pristine and plaque free, and bacteria, keeping the bacteria down so the decay doesn't have a chance to harm those gorgeous restorations that you have in your mouth. How do you feel about that? Another one, you've mentioned that you're having severe sensitivity. Would you be interested in relieving that pain with a fluoride varnish today? And then following up the fluoride varnish with home fluoride treatments. Can I tell you about that? Let me tell you about that. Are you interested? Who's going to say no? They may, and that's okay. Remember, we don't have to focus on 100% of the patients. We need to make sure that we focus on the patients that need it and want that type of treatment. Okay. Fluoride treatment gives them a reason to come back. We know that patients in general dental practices for hygiene retention oftentimes fall past due. They oftentimes will not reschedule. They oftentimes will cancel or try to reschedule. So when you have a call with a patient and they're saying, you know, I've really been doing really good, and I just don't feel like I need to come back as soon as Dru wanted me to. And I think I'm just going to put it off for another month. I'm really busy. I have a lot of vacation. I have kids to chase. You know, all of the things that they say. And I'm sure some of you are chuckling, going, oh yeah, we heard that one. So this is a great way to combat the patients that want to delay or cancel. Mrs. Jones, I know that your hygienist, Chrissy, that you saw last time, I see that she prescribed to you home fluoride and that she did a fluoride treatment with you. And I know that the both of you were concerned about the possibility of decay happening around the margins or the where the crown meets the tooth. I know that you were both concerned about making sure that that was nice and strong, and we were able to keep those restorations in excellent condition for a long time. Tell me, how can we make it possible for you to get here to this appointment so that we keep looking and preventing anything that can go wrong with those restorations? How can we get you here? This is your interval. This is the proper time for you to come in. How can you get in here so we don't delay your appointment and possibly cause harm to those restorations? They're going to say, oh, well, I didn't really think about that. I guess I will come. I'll come before I have vacation and have kid stuff. I'll figure it out. So it's important to have that as some ammunition that you can use to fight off cancellations and changes in your schedule. Okay. Another reason to come back: celebrate the health and continue the continual need to prevent disease through excellent dental care. Talk about what you're doing for them to keep them as healthy as possible. Talk about the disease and the relationship to their interval that they have. So one thing that I will talk about is how long it takes a healthy person with a good immune system, how long their body will fight off the bad bacteria that can cause periodontal disease or decay. And it's about 3 months. So if their immune system isn't healthy, isn't running at top speed, I call it superhuman speed, superhuman strength. If they don't have that good immune system, then talk to them about that and talk about the continual need to prevent disease through their home care and through staying current in the retention system and utilizing the fluoride. Don't run out of fluoride and don't be late for your next fluoride treatment. We want to make sure that you stay healthy. Those are all great verbal skills to use when you're developing your plan and your program for your practice. Oh, I went too fast. This is a great slide. I'm looking at my time to make sure that I'm not running over. Without a sense of urgency, desire loses its value. Always do linkage communication. So I want to talk about this really quickly. I'll wrap this up in just a few minutes. Linkage communication. As the hygienist talks to the patient, they're going to educate the patient. They're going to gather information. You are going to show them videos, you're going to show them photos, you're going to show them comparisons, you're going to show them all of the charting and documentation that you've done. You're going to talk to them about the medical history. Now, if it goes no further than that, that is not as effective as and this is what the hygienist would talk about. And you can take a photo of this if you want to, and you can utilize this. But it's not as effective if just the hygienist says it. But when you get the doctor involved in that evaluation and you're able to share with the patient and the doctor what the information is that you have gathered and how you want to take care of that patient through the future with fluoride treatments, and the doctor then validates the information that has been gathered and the importance of the hygiene appointment. And then also doesn't hurt to validate each other's abilities as hygienists and as doctors. Make sure that you listen, doctors, to the hygienist as they review the findings that they've done to that point. Now, in our teaching, we love to do the 20-20-20, We want that evaluation to be done in the middle 20 minutes of the appointment. So if you can get that to happen in your appointments, you'll find that the hygienists have already gathered all the information. Teeth aren't clean yet, probably may have started, but the second 20 minutes, you need to come in for your evaluation, doctor, at some point in time in that 20 minutes. And the patient's mind is still focused on the appointment. They're not out the door thinking about all of the day that is going to come. They're going to focus on what you're saying, and they're going to look at the photos with you, and they're going to probably point out what things we've already talked about in the first part of that appointment, looking at the radiographs with the patient, the scans, and then work as a team to get that patient involved in the fluoride treatment for both home and in office, if that patient is a candidate. And you can talk about that as well at huddle before the day begins. So you can pre-plan, hygienists and doctors, what patients you want to choose. Who are the most dire? Who are the most dire? You have 50% of your patients involved in fluoride treatments and 50% are not. So that's a lot of opportunity for your practice. Successful people do consistently what others do occasionally. Craig Rochelle, one of my favorite folks, it's a great quote. We have to do it and talk about it and recommend it consistently. Patients are going to say no. One patient may say no for 3 appointments, and then by the 4th appointment, boom, they say yes, and they want to do the fluoride treatment. So it's really interesting. Watch your successes, talk about your successes as a team, and I hope that you have had an excellent hour of education. Please, I want to hear some questions, and if there are any, and then I also want you to have my email address. So if you do have questions, feel free to reach out to me, and I'll be glad to answer any questions that you have. And Adam, do I have any other questions that came up?
Oh, yes, there are a couple.
Okay.
Let's see. One came in relatively early. I think talking about potentially a reply from patients if there's fluoride in their toothpaste.
Fluoridated toothpaste has enough fluoride in it so the toothpaste can say fluoridated. It's a very low concentration of fluoride, so the prescription strength fluoride in the paste, in the prescription strength paste and the prescription strength rinse, it is a higher level of fluoride concentration, so that it really works so much better to fill the tubules and to make the root surfaces harder and make the enamel stronger so that it can continue to stay healthy longer.
When you say smooth surfaces of the teeth, that does not include root surfaces, correct?
Yes, it does.
Okay. Does fluoride help protect exposed roots as much as it does to the smooth surfaces?
Yes, it does. Even more because the root surfaces are more porous. So there's more places for the fluoride to go. There's more tubules to fill.
Right. We gotta check the chat here too. There were a lot that came in.
One thing that I when you paint on the fluoride, do you have to put it all over the occlusal surfaces of the teeth so when they bite together it feels sticky? You don't really need to. You can put it all on the smooth surfaces interproximally around the gum line, and that's going to make a huge difference for those patients.
How do you introduce fluoride in your office?
How do I do that? Through
Yes.
the questionnaire, through the quiz, through the gathering of the information, and then finding something, a reason why they need fluoride. And then I'm going to talk to them about that. So I'm going to say, just like the verbal skills in the presentation, Mrs. Jones, you have sensitivity in 4 areas of your mouth, and those areas of sensitivity haven't been there in the past. And it's concerning to me that it's there, and it's really evident that that cold and then the warm bothers you. There is nothing that we have found on the radiographs, in the photographs, at the doctor's evaluation. And so these areas need extra protection. Can I tell you about some products that would help you with your hot and cold sensitivity? And they're going to say, yeah, tell me about it. And you're going to dive into the in-office fluoride and the home fluoride treatments.
Will fluoride varnish help white spot demineralization?
I don't, that is a question that you would need to ask your representative. MI paste, I know, can reverse that in some method of some sort, or ACP can. You would have to ask your representatives what that would look like and how they would utilize that.
All right. Let's see. How do you implement after never having prescribed before?
This is my favorite verbal skill. We now know. We now know that fluoride, topical fluoride, both in office and at home, can make a difference in your decay rate, in your gingivitis that you have, in your sensitivity, whatever it is that they have, your dry mouth, whatever it is. That's the verbal skill that I would use. We now know. This is a new program that we are working on. We're offering these products to adult patients because we now know.
All right. Couple questions on how much to typically charge for a fluoride varnish.
You can look at fee surveys. You also need to look at the cost of your fluoride products and make sure that you have a profit margin that works for your practice. So depending on where you are in the area in the United States, that will make a difference. And then what you're paying, what product you're paying for. Some products are more expensive than others. So make certain that you look at that, and then look at the fee surveys that are available for you in your area.
All right. This one may have been a clarification question, but feel free to chime in if it's not.
Okay.
So it is acceptable to only put fluoride varnishes on occlusal surfaces?
It is acceptable. The fluoride varnish will work where you don't have to glob the fluoride on every occlusal surface. A little swipe on the occlusal surface would be great, and then swipes along the facial and the lingual, making sure that you push some of that interproximally will make a difference. Okay. Thank you guys so much for the question. I appreciate it.
There's a lot more if you got a couple more minutes.
Oh gosh. Well, they may not. It's 7:03.
Well, we'll do a couple more.
Okay.
Let's see. Some of my at-home fluoride patients will decline in-office fluoride treatment. Do they need both?
They will benefit, the ones who punch, remember, they will have more benefit if you utilize both. One is better than not at all. Figure out why the patients are saying no to the type of treatment that you want to do for them, and see if you can work through the concerns. And if you can, then get them to say yes. I can promise you a lot of times it's my insurance won't pay for it. So, but I have a prescription card, so I can use that for my home fluoride, but my in-office fluoride, I have to pay out of pocket. So talk to them about the investment in the fluoride and the potential investment in another restoration.
All right. Since we are over time, just a reminder, you can email Dru directly. Her email address is on screen.
Yes.
For any that put questions in the Q&A, I will get those over to Dru as well, and she can get a written response back to you. Couple questions asking if we offered CE. We did not offer CE tonight, so I apologize for that. But otherwise, yeah, we did not get to everyone's questions, so we'll get those to you, Dru, tomorrow.
Okay, perfect.
I would like to thank you for your time tonight. Great presentation. Thanks for sharing the important information. And thank you to all of you who told the truth on how often you floss.
I love it.
I do not floss every day. So I will admit, and you can put a name to an answer on that one.
Another number, adult number on that side of the poll.
Yes, I did not partake.
I love it. Everybody have a great evening and enjoy your weekend. And thank you for attending.
Great, thank you. And we did record this, so we'll get that out to everyone in the next week or so. Have a great night, everyone.
Thank you.